We talk about resilience, Dr. Adalja. Resilience comes from policy. Which nation seems to be most supple, most malleable at reacting to this pandemic and initiating constructive policy?
I would say that has to go to Taiwan and South Korea. These countries have been able to do, they were able to do in March and February what we can't do even in the United States now in November. And they were able to meet cases as they came because they had a robust policy of trying to interdict very early and being very proactive versus reactive. And they sprang into action very early. South Korea and the U.S. had their first cases on the same day. And just look at the difference in the trajectory because they put in a policy of testing, tracing, and isolating, something we still sadly cannot do in many parts of this country. And we're facing the consequences of that now as we enter these cold months where this virus's transmission is accelerating.
Amesh, I want to talk about the vaccines in a second, but first, is there a danger that poorer countries just won't have access to the vaccine, to any vaccine, quick enough?
I do think that's going to be the issue, and it's always the issue during an infectious disease emergency, where you find a disparity between the developed world and the developing world. And we saw that with 2009 H1N1. We still see it with vaccines like measles and polio. So this is going to be a major issue. One of the issues is also the fact that one of the vaccines, the Pfizer vaccine, requires an extreme cold chain, which is going to be hard to keep intact when you're talking about the developing world where electricity may be spotty and we have difficulty even with refrigeration. So I do think that this is going to be a longer endeavor when you're talking about the world. The developed world may, mid-2021, have enough of their population vaccinated to have COVID-19 cease to be a public health problem, but it is going to be a challenge for many other parts of the world. And that's what the Bill and Melinda Gates, that's what the COVAX consortium, all of these other entities are trying to assure won't happen. But I do think it's going to be hard going for many of those countries.
Dr. Adalja, how much, are we focusing too much on these vaccines and the fact that a lot of these vaccines are coming even quicker than expected and not focusing enough on hospital capacity, especially in the U.S.? How critical is hospital access right now?
For the next several months, hospital capacity in the U.S. and around the world is going to be the major factor because these vaccines are going to be coming, but they're not going to be available in big enough quantities to make a dent on all of the patients that are already hospitalized. There's around 80,000 Americans hospitalized now. That's something that we have to get through, and it's going to only continue as we go through the Thanksgiving holidays and we see that expected surge that's going to occur.
Right.
So this is something we have to think of these vaccines as lights at the end of the tunnel, but we still have a lot of tunnel to go, and a lot of people are going to die between now and the vaccines, and a lot of hospitals are going to be worrying about capacity long before the vaccine starts hitting the arms of Americans.
Dr. Adalja, would you get on an airplane this Thanksgiving holiday?
It's not actually the airplane itself that's the danger because everybody is masked there and they've got a lot of mitigation. It's what you do when you get to your destination. That's the problem. It's not the conveyance by the airplane. It's what you do when you get there. Just like in the summer, it wasn't the airplane that got you to Myrtle Beach that got you in trouble. It's what you did once you got into Myrtle Beach. So it's the mixing of people that happens when people travel at their destination. That's the issue. I think the airlines have done a good job at keeping the air travel component safe. It's just what people do when they get to where they're going.